So I'm going to bring it back to you, Nate, and talk about, maybe you can share a little bit about Doximity, which is a physicians-only network, and why you see physicians kind of going there, and maybe you can share with the group what Doximity is and maybe a little bit about how it works.
Sure. So I think as a segue into that, a few other things that have happened recently that have led to people being able to join these kind of communities, whether they're a doctor or a patient. The first is that a lot of us are using social media now for everything else outside of health. And so we're comfortable with it now. We've started using it for sports or for news of our friends' life events. And we are able to, there's a whole generation out there that has established their entire identity within society, deeply integrated into that being their social experience. The other thing that's come along with that is technology. So enough people now have internet access. Physicians, actually 85% of them are on a smartphone, the vast majority of which are iPhones. And so being able to have those prerequisite steps and prerequisite experience using social media for other purposes is extremely important. Now, on Doximity, why is it happening? As by background, Doximity is a physician-only network that is starting to expand to other members of the care team. And its goal is to use social technology to help doctors be more successful in the practice of medicine. Now, I'll put it in perspective. All of you in this room are very, very smart in various niches. You probably have way too many graduate degrees under your belt. And you probably belong to a couple different alumni societies. Nobody here rolled out of bed in the morning and said, gee, I wonder what's going on in my alumni society forum, right? Because you have too many other things to do with your day. And doctors have been the same way. They have a lot of patients to see. And so in the past, the right incentives haven't existed to join social media. Certainly we're barely getting there with telemedicine to have any sort of financial incentive. And so what Doximity's had to do is just make them more successful in their practice. Everything we design in our social network saves doctors time, so they can look up any other doctor in the country, send them a secure message, give them a phone call, refer a patient, or get a quick consult on one of the patients that they already have, stay up to date on the medical literature, or find a job. None of those things require expending extra time with their day. They actually save the doctor time in their career. And the ability to add those kind of services to social with social is something that's only been possible in the past few years.